Welcome to a deep dive into the world of borderline personality disorder. We're going to be talking about a research paper called Treatment of Borderline Personality Disorder, and it's written by Jorma Tähkä. And one of the things I think you'll find interesting about this isn't just for clinicians. This is something that I think we can all learn from and apply to our own lives.
Yeah, definitely. This paper talks about how borderline personality disorder might actually be curable.
Okay, so that's kind of a bold statement.
Yeah.
I mean, borderline personality disorder, we always hear that it's a lifelong struggle. So what makes this guy Tähkä think differently?
Well, his viewpoint comes from his experience treating patients with BPD in a day hospital. And his approach is deeply rooted in object relations theory.
Okay, so for those of us who aren't therapists, what is object relations theory and how does it connect to BPD?
Basically, object relations theory is all about how our earliest relationships shape who we become. So, as babies, we're completely dependent on our caregivers. And those early interactions, especially with our parents, form the foundation for how we learn to trust, how we regulate emotions, and how we build relationships later in life.
So if those early relationships are messed up, that foundation is kind of shaky, right?
Exactly. And when we talk about borderline personality disorder, Tähkä says those early relationships are often with parents who are themselves emotionally unstable.
Oh, I see.
So the child has to adapt to survive in that environment, which can be pretty chaotic.
So they kind of create these false selves to please their parents?
Yeah, you got it. They try to become what their parents need them to be, but their true self gets buried in the process. Tähkä calls this the chaotic self. But there's another part of the personality, the healthy part, that's trying to grow, and he calls that the developing self.
So it's like two parts of the self kind of battling it out.
Exactly. And it's that chaotic self that often drives those classic BPD symptoms we hear about. The fear of abandonment, the unstable relationships, impulsive behavior, self-destructive tendencies, intense anger, and that deep feeling of emptiness.
It's almost like they get stuck in that terrible twos stage of development.
That's an interesting parallel. Tähkä does suggest that BPD can be seen as getting stuck in some ways. Like that chaotic self takes over and the developing self gets pushed aside.
So how do you help that developing self come out? Is that what he means by curable?
Yeah. Tähkä believes treatment should focus on strengthening that developing self. It's about helping the patient to understand their chaotic self, where it came from, and how to get control over it.
So how do you actually do that? The paper mentions some specific treatment methods, right?
Right. So one of the things they used in the day hospital setting was having a personal nurse. And this nurse really plays a crucial role.
How so?
Well, the nurse provides a stable, supportive relationship for the patient. It's kind of like a corrective emotional experience. They get a chance to learn to relate to someone in a healthier way.
Like a new template for how relationships can be.
Yeah, exactly. And in addition to that, they also had these community groups.
Community groups? I would think that could be kind of intense, bringing a bunch of people with BPD together.
It sounds that way, but these groups actually provide a safe space for patients to practice social skills, and they can start to see how their old relationship patterns might be playing out.
I see. It gives them a chance to kind of rewrite those early scripts in a safe environment.
Exactly. And another key technique they used is something called empathetic description.
Empathetic description. I've never heard of that.
So basically, it's where the therapist helps the patient understand the root of their emotions, help them put words to those feelings.
Oh, so it's not just reacting to those feelings blindly.
Right. It's about helping them understand their story and where these feelings come from. But along with all this, Tähkä also stresses the importance of setting limits with the chaotic self.
Isn't that kind of risky? I mean, if someone's already experienced a lot of rejection early on, wouldn't setting limits make them feel worse?
I see what you're saying. But he argues that setting boundaries is actually super important.
Okay. How so?
Well, it helps to create a safer environment for the developing self to grow. It's less about punishment and more about creating that stability that might have been missing early on.
So it's not just being nice and letting them do whatever they want. It's about being firm and consistent too.
Right. It's about saying, hey, we care about you. We're here for you, but we're not going to let you hurt yourself or others.
So it's like a balance of warmth and firmness.
Yeah. And in that space where you have that balance, that's where real healing can happen.
Okay, this is all making a lot more sense to me now. I'm starting to see how it all connects. But how does this relate to us? I mean, we're not therapists. How can we apply this to our everyday lives?
That's a great question, and it's something we're going to be talking about more in the next part of this deep dive. But I think it's safe to say that understanding BPD is about more than just diagnoses.
Okay.
It's about recognizing patterns in ourselves and in others. And it's about understanding how those early relationships can shape who we are and how we interact with the world.
It's like a whole new way of looking at things.
Exactly. But we'll save that conversation for next time.
Sounds good. Before we went to whatever that was, we were talking about how understanding BPD can help us see things differently, not just on a personal level, but like on a larger scale, like in society.
Oh, yeah, for sure. BPD really gives us a glimpse into those strong emotional and relationship patterns,
Yeah.
the ones that can play out on a much bigger level.
And Tähkä makes some pretty bold connections in his paper. He even links BPD to these destructive ideologies like communism and fascism, even terrorism. That seems like a bit of a stretch, doesn't it?
It might at first, but when you really think about the heart of BPD, that fear, the need for control, that black and white thinking, well, you can see how those patterns could feed these dangerous ideologies.
So it's like those weaknesses can be used and made bigger in a group or movement.
Yeah, exactly. Tähkä even says that these ideologies might prey on that chaotic self, giving them a sense of belonging and purpose, but also fueling that rage, that need for revenge.
It's kind of scary to think about. He even brings up school shootings, which is such a sensitive topic. Is he saying that all school shooters have BPD?
No, not at all. Remember, BPD is complex, and not everyone with those strong emotions will become violent. But Tähkä points out that a lot of school shooters have a history of being left out, of not belonging. And a lot of times they've even asked for help before they resort to violence.
So it's not just about seeing the warning signs, but about understanding what those who are hurting really need, those who might be caught in that chaotic self.
Exactly. It comes back to object relations theory and how those early experiences can create such deep wounds. And if those wounds aren't taken care of, they can come out in all sorts of bad ways.
It's a lot to think about. We've gone from personal problems to society's problems and now violence and terrorism. It's hard to wrap my head around it all.
I know it is. But the point isn't to feel overwhelmed or like there's no hope. It's to see that there's a way forward, a way to break these cycles of pain.
So how do we do that? How do we create a world where these ideologies lose their power and people feel safe to be themselves?
Tähkä believes it begins with making that developing self stronger, both for individuals and for society as a whole.
What would that look like?
Well, on an individual level, it's about seeing those early wounds, those unmet needs, and addressing them. It's about being compassionate and supportive, creating spaces where people feel safe enough to be vulnerable, to say, hey, I need help.
And what about for society?
It's about building a culture of empathy and understanding. It's about systems that help people develop in a healthy way, that give resources to those who are struggling, and that put connection above being alone.
So it's not just therapy and pills. It's about creating a world that's more humane and caring.
Exactly. A world where people who are struggling with these intense emotions and vulnerabilities feel seen and heard and like they have support.
That sounds great, but it also sounds really hard. Where do we even start?
I think it starts with awareness. The more we know about these complex things, the better we can respond with compassion instead of fear and judgment.
So it's about learning, not just about BPD, but about how important those early relationships are, how they shape us.
Yes. And it's about being open to having tough conversations, to challenge those harmful stereotypes about mental health.
The paper talked about empathetic description as a therapy tool.
Yeah.
Can we use that in our everyday lives too?
Absolutely. It's about learning to really listen, to see beyond just what's on the surface and try to get those underlying emotions and needs, the ones that might be driving someone's actions.
So don't just react to the anger, but try to see the hurt underneath it.
Exactly. And let them know their feelings are valid. Let them know they're not alone and that their experiences matter. They deserve compassion.
It sounds like it takes a lot of patience and trying to see things from someone else's point of view.
It does, but it's also incredibly powerful. When we start connecting with each other on that deeper level, it opens up the chance for real change.
Change for individuals and hopefully for society too.
That's the goal, right? To build a world where people feel safe enough to be themselves, to connect with each other in real ways, and to create a future without fear and violence.
That sounds like a pretty amazing world. But it seems like there's a lot of work to do to get there.
There is. But it's worth it, don't you think? And it starts with each of us. Making that promise to understand, to empathize, and to create those spaces of safety and support.
We've talked a lot about the big implications of VPD, but I want to circle back to those who are actually living with this every day. What about the symptoms themselves? How do they show up in someone's life?
That's a good point. And that's something we'll dive into right after.
Okay, so we're back. And, we've been talking about the big picture, but what does BPD actually look like day to day? What are some of the signs that someone might be dealing with this?
That's a good question. And it's important to remember that BPD can be, well, it's complex, right? Everyone experiences it differently. But there are some common symptoms that can really affect someone's life.
The paper lists 9 criteria for diagnosing BPD. I'll be honest, I'm not a therapist, so all that clinical jargon can be a little much. Can we break it down, in a way that makes sense for regular people?
For sure. Let's start with the one that's often at the heart of it all. This intense fear of abandonment. You might think, well, everyone hates being left behind. But with BPD, it's way more than that. It's this deep, gut-wrenching terror of being alone, rejected, abandoned.
So it's not just feeling sad when a friend cancels plans. We're talking like panic attack level fear.
Exactly. And that fear can drive all kinds of behaviors. Someone with BPD might cling to others, constantly need reassurance, even sabotage relationships to avoid the pain of being rejected later. It's like this self-fulfilling prophecy where they push people away because they're so afraid of being pushed away.
Yeah, that's got to be tough, to live with that kind of anxiety all the time.
It is. And it often leads to another big thing with BPD, unstable and intense relationships. Picture this. One minute someone's the best person ever, and the next they're the worst. That kind of black and white thinking going back and forth between idealizing and devaluing, it creates a lot of chaos in their relationships.
Yeah, I can see how that would make it hard to keep healthy connections.
Absolutely. And then there's this feeling of not knowing who you are, what clinicians call identity disturbance. People with BPD often struggle with a shaky sense of self. Always searching for an identity, but never really feeling grounded.
Like looking in a mirror and not recognizing the person staring back at you.
Exactly. They might jump between different personas, keep changing their goals and values, or even feel like they don't exist at all.
That's got to be so disorienting.
It is. And then add impulsivity on top of that. We're talking about risky behaviors like spending too much money, substance abuse, reckless driving, even hurting themselves. Like they can't hit the brakes when it comes to those strong emotions.
The paper also talked about suicidal thoughts and behaviors. That's really serious.
It is, unfortunately. It's pretty common with BPD. They often struggle with intense emotional pain, and things like self-harm or suicidal actions can feel like the only way out. If you or someone you know is dealing with these thoughts, please reach out for help right away. There are resources, and people do care.
It's so important to remember that these are real people who are hurting.
For sure. And that hurt can show up in other ways, too, like those extreme mood swings. It's not just regular ups and downs. It's more like an emotional roller coaster. Intense anger, anxiety, depression, hitting them out of nowhere.
Yeah, that would be tough, not just for them, but for everyone around them, too.
It's hard on everyone. And then on top of all that, there's this chronic feeling of emptiness, like a void that can never be filled. A deep loneliness that can lead to some unhealthy ways of trying to find fulfillment.
And then there's the anger, which the paper calls inappropriate and intense. Does that seem kind of judgmental to you?
Some of that clinical language can sound harsh, but what they're really saying is that the anger in BPD is often way bigger than the situation calls for, like a volcano erupting. It can be scary for the person and for everyone around them.
Okay, that makes more sense. The last thing the paper mentions is transient stress-related paranoid ideation, or severe dissociative symptoms. I don't even know what that means.
It basically means that when under a ton of stress, people with BPD can experience temporary paranoia, delusions, even feeling detached from reality, like their sense of self breaks apart under pressure.
Wow. So we've covered a lot, from fear of abandonment to unstable relationships to intense anger, even paranoia. No wonder people with BPD have such a hard time. It sounds really painful.
It absolutely can be. But it's important to remember there's hope. Teke's research suggests BPD can be treated, that healing and recovery are possible. And the more we understand about this disorder, the better we can support those who are struggling.
This has really been eye-opening. I feel like I have a much better understanding of BPD, not just the symptoms, but the deeper reasons behind it all.
Me too. I hope it's been the same for everyone listening. We've learned about the importance of those early relationships, the struggle between the chaotic and developing selves, and the potential for healing.
We even talked about how understanding BPD can help us make sense of bigger problems in society and maybe create a more compassionate world.
Exactly. Knowledge is power. And the more we know about ourselves and each other, the better we can handle life's challenges and build a world where everyone can thrive.
It's been an amazing journey. Thank you for joining us for this deep dive into borderline personality disorder.